wanted to talk about this story because it feels like in the last day and a half, it was kind of buried in some other big headlines as well. But the nation's largest insurers, some of them, and insurance industry groups have agreed to, I guess, sort of a handshake deal to address problems caused by prior authorization. Health and Human Services Department officials acknowledging that while they have this agreement, they may need to take additional regulatory action to see this through the way that they want. So joining me now is Dr. William Soliman, CEO of the Accreditation Council for Medical Affairs. This is a group that tries to simplify this process of getting pre-approval for prescription medications for both patients and doctors' offices. Thanks for joining us.
Sure, my pleasure. Thanks for having me.
So let's start, I guess, at the beginning. Start by explaining, what pre-authorizations are and how these can affect healthcare.
Sure. Prior authorization is basically when a healthcare insurance provider basically requires a doctor to get more approval, additional approval, before delivering, a medication or a service or a procedure. So, for example, if you go to the doctor and you're supposed to get a particular medication or get an MRI, the insurance company might say, before we approve this, we need more justification for why this patient needs this service or this medication. So it's really there to control costs, make sure that the doctor is providing something that's clinically appropriate, and it's a way for obviously the healthcare insurance companies to make sure that they keep their costs low.
And when it causes problems for patients or doctors, how widespread is that? How common is that?
It's a big issue. The number one reason for care delay in the U.S. is due to prior authorization. It's the number one reason for delays in care. It's a big administrative burden. It costs doctors billions of dollars a year, and it also can put patients at risk because if you deny coverage, you can be in a situation where, let's say, you need a particular drug or a procedure or a test, and you can't get it for 1 or 2 months. That delay can actually cause problems. I was talking the other day to an infusion pharmacist who was telling me that their patient was delayed access to important treatment for their cancer for 3 months. So it's a major issue, and this is why our organization is really a big supporter of educating and certifying the people that do the prior authorization. That's what we do, and it's an important issue because in the end of the day, if you don't know how to help these patients get access to the medications, like I said, it could delay care.
Yeah. So let's talk about this current, we're characterizing it as sort of a handshake agreement by the healthcare CEOs. What are they agreeing to exactly, or is it still kind of fuzzy?
So look, the health handshake agreement by the healthcare CEOs, really it's a voluntary, I would say a non-binding commitment by CEOs of a lot of the healthcare insurance companies to say, look, we're going to make sure we do all we can to minimize administrative waste, improve access to care, be more transparent around drug pricing. But the truth is that it's just like the name implies, it's a handshake. There's no accountability. There's no law in place, right, that says, hey, you have to do this. Some people who are skeptics of this say that this might just be a PR move by these companies. So it's not really clear what impact it'll have. I think it has good intentions behind it, but ultimately I think to get a real substantive change, you have to have pressure from policymakers ultimately.
Yeah, and I guess that's my follow-up question then is, if legislation and laws are really the only way to be able to enforce something like this, where have we been? Where are we now as far as moving toward legislation that might change this?
So there's a few bills now that are being proposed in 2025. There's the Seniors Act, the Reducing Delays Act, Doctor Knows Best Act, and they're all basically trying to push more transparency for prior authorization, making sure that doctors have a bigger role in terms of denying or approving care. But the truth is it's tough to get these things approved because at the end of the day, there's a lot of players that are involved. Today, actually, in the news, we saw RFK Jr. and Dr. Oz announcing that there's a pledge to reform prior authorization. But this has been going on for years. So ultimately, whether or not we see this actually come into reality and actually happen is a different story. Again, I think there's a lot of good intentions behind it, but there's a lot of players in this world of prior authorizations that sometimes makes it difficult to actually see substantive change.
So as somebody who's been in this for a long time now, what's your sort of cautious optimism, like from 1 to 5, 1 being, less of a chance, 5 being saying, I think this is going to go through? Where are you?
If I'm really pushed, I would say a 2, because I think, and I don't mean to be, cynical about it, but I think that part of the reason why I am is that you really need an overhaul of the healthcare system in the United States, and really need to think about the role of those pharmacy benefit managers, the middlemen, as they've been called by, for example, President Trump in his first administration pointed that out. And I think in the end of the day, we need to better understand the hold that they have really when it comes to drug pricing, drug transparency, and really make sure that things are done in an equitable fashion across the board. And so I think until that's addressed, it'll really be difficult to really see actual change when it comes to prior authorization.
And did I see also, you've testified before Congress, was it specifically about pre-authorizations? And tell me a little bit about that. What was that like?
Yeah, so a few years ago, I was asked to testify before Congress, the Health Subcommittee, related to standards in the pharmaceutical industry. And, I don't know if you know this, and this is probably surprising to a lot of the viewers watching this, but until our organization came into existence a decade ago, the ACMA, there were no standards when it came to the people that were going out and selling and educating doctors, including around prior authorization support. And so we were advocating for the importance of having standards. And so our organization certifies and credentials pharmaceutical reps and medical people that go out and talk to doctors. Because remember, when a doctor graduates medical school, the majority of the education that they get comes from the pharmaceutical industry. So making sure that there's actual standards in place around reimbursement, prior auth, selling, things like that is very important from my perspective when it comes to patient safety.
As you said, you've been doing this particular work for about 10 years. As you take a look at the landscape right now, just from an outsider looking in, as I take a look at what's been happening with United Health Group that's based here in Minnesota, as we're watching the sort of business side of that, and then the perception side of that with social media, and of course the tragic murder of the executive. It feels like, to someone who maybe isn't part of this as directly, we're on the precipice of something changing, something shifting. People are starting to wake up maybe a little bit more to the what's broken. Do you feel that, or are you just kind of like, you know what, I've been dealing this for so long, it just nothing really gets me too excited about what's happening?
No, actually, you bring up a really important point. I do think we're on the cusp of something important when it comes to healthcare reform because of what happened. Because I think what this whole situation showed, obviously it's a tragic situation, nothing justifies it, but what it showed is how frustrated Americans are with the current healthcare system. With United Healthcare too, I think the big thing that was uncovered was the role of AI. Remember, now everybody's using AI for everything, and apparently United Healthcare was using AI to deny claims. Now that could be an issue, right? Because now you're relying on an algorithm, and if that algorithm is designed in such a way to deny claims more than to approve them, let's say due to cost cutting, if that's how the algorithm is developed, is that really equitable and fair to patients? And so I think the new thing from my perspective is, what's the role that AI is going to play in decision making? Because again, United Healthcare is being dinged for that in terms of whether or not they were using this algorithm to save money instead of really help patients.
Yeah, I'm sure, as you know, the Wall Street Journal has done an incredible deep dive into this, testified before Congress, and talked about the AI, some of the other issues with the adding diagnoses, things like that. So it's just the issues just seem to we're not just talking about prior authorization, although as you point out, this is a big one. What are you going to be looking for here in, I guess, the coming weeks and months, as far as, is this prior authorization agreement going to be kind of coming to fruition?
Ultimately, it's about action, right? What action, tangible action will the companies take to streamline prior authorization? One of the things that we've been, supporting and advocating for is working with pharmaceutical companies to help provide education to a lot of the healthcare providers and their staff through certification, through training that we offer. Currently, we work with hundreds of pharmaceutical companies, and on their end, they've seen a significant impact in terms of the role that education plays. For example, with the programs that we offer, our certifications that we offer for prior authorization, we see a 45% reduction in denials. That's huge. What that tells you is that if someone is trained right and really understands the administrative component in terms of how to handle rejections and denials from health insurers, you can actually help make it easier for patients to get access to medications. At the end of the day, for me as the CEO of the ACMA, that's the number one thing. We're trying to help patients get access to important medications. We don't want patients suffering unnecessarily and being delayed treatment to important medications.
Yeah. My final question, do you feel like this is an issue that's going to have bipartisan support as it moves forward?
I do. This is one of those issues that you find if you look at some of the bills now that are being proposed in Congress, there's bipartisan support. I think on both sides of the fence, both parties want to help patients. They want to make sure that patients get access to the medications they need. So I think that's a positive, right? So this isn't, something that one side necessarily doesn't support. So from that standpoint, I'm very optimistic.
Okay. Dr. William Soliman, CEO of the Accreditation Council for Medical Affairs. Thank you for your time. We'd love to check back in with you here periodically as we go and see how they're doing.
Absolutely. Thanks for having me. Thank you.
Appreciate your time. Thanks.